The signs that you would look for when you're trying to evaluate if somebody does or does not have sleep apnea, these are witness things that you can observe just in the bedroom at home. When you're watching somebody sleep, check if they snore. If there's very loud snoring, they might have airway resistance, upper airway resistance. Then, if you hear them stop snoring, there's usually a pause in their breathing. That's not a good sign. That's something that we know indicates that people do have obstructive sleep apnea. Then, again, if it's more than 10-second pause and it happens more than a couple of times an hour, it could be potentially dangerous. The other three signs, Whitney, are a neck circumference larger than 16 in women, larger than 17 in men. This third thing would be a body mass index higher than 35, and that's the weight to height formula that we talked about. Again, body mass index over 35, high suspicion for sleep apnea. Then the fourth thing is excessive daytime sleepiness or daytime drowsiness. We know that if people score themselves a 10 or higher on what's the Epworth Sleepiness Scale score, we know that they are usually a very strong candidate for possibly having sleep apnea. You can usually go to a website or even Google sleep apnea or Epworth and learn if you're even possibly a candidate for being tested for sleep apnea.
So is it common for somebody to have maybe only one of those signs or two of those signs and still have sleep apnea?
Well, generally if they have two or more, it's highly likely that they have sleep apnea. Again, I told you, it's not always weight related. It's not always a large neck. Sometimes it's a small jaw. So if we had, let's say, a 20-year-old girl that weighed 110 pounds but had a very tiny jaw, she might have a small throat space. And if she were to say that she was excessively sleepy, never felt rested when she woke up in the morning, and her bed partner said she snored, and she scored herself higher than a 10 on the sleepiness scale score, it's possible that she could definitely have sleep apnea. Well, when you think you have sleep apnea, the first thing to do is probably go see your primary care provider or your family doc and talk with them about it. If they make an assessment and figure out that you're not just fatigued or sleepy from some other medical problem that's underlying and not showing up in blood tests now, maybe you do have sleep apnea. It would be reasonable at that point in time to maybe seek a sleep consultation from a specialist. Dr. Addy's sees patients here in Big Rapids, and we have a sleep clinic with locations all over. We go to Fremont. We're going to be going to Reed City soon. We're going to be all around the area. And get a consultation with a sleep specialist who can really do a very honed in, a very close observation about what your symptoms are and really decide whether a sleep study is indicated.